Just showing some examples on working with a client after lumpectomy surgery, also called wide local incision. I've just covered up her nipple just so that we can put this out and it's less obtrusive for her, and also means that it's likely not to get blocked if we put some things into social media. So excuse the taping and the pad over the nipple area, and that's not for any medical reason, that's only for looking after her modesty. So what we've got is a scar coming down, T-junction at the bottom here, the scar runs along the bottom, we've also got some scarring around the nipple. What you'll see is you get a lot of shortening through this scar that goes vertically down the breast, and we can see that in the way that the tissue gathers underneath. So this tissue needs a little bit of stretch, so we can just come along this tissue and apply some superficial stretch. When you're doing this, it doesn't feel nice to push down and pin against the ribs. So you're trying to gather the tissue and pull it away from each other without pushing down into the body, because actually this already is a little bit dipped down. We can see a little bit of tightness. We notice that if we squeeze on here, there's definitely some reddening that occurs, some gathering around those areas. So we don't want to encourage that to go further down. What we're trying to do is create that stretch of the skin and that scar tissue underneath to try and open up that. As this releases, you'll get a nicer profile along the bottom here. We often have skin at the bottom, or after mastectomy surgery, which has got some quite deep tethering, might be stuck down onto the ribs. We've had quite a few treatments with this client, so what we can see is actually that this scar does move quite nicely. But how do we get to this point? It's really important to sit on the scar with your fingers and really make sure that this moves in different directions. Try and take as much of the scar as you can. Make sure that it's not uncomfy for the person having treatment, and really move this in all directions. But what if you're working with somebody who's really recently had surgery and that would all be either a bit uncomfy, or you're worried about that there's some deeper stitching which is still the cohesion is still occurring in the deeper tissues and we don't want to actually disturb that too much, then I would suggest just a really simple depress and release, working over that area, just a gentle pumping movement to encourage fluid exchange, to soften some of those thicker bunching fibres that you might feel even in the very early weeks, and that can be really helpful to decongest the breast and help clear that out. In terms of self-treatment, it's not always easy when you're working after breast surgery, but I've got some simple tools for you. These great little massager devices are designed for lactating mums in order to help encourage the milk to drop down, but essentially they're really soft, ergonomically shaped, they provide a vibration massage, and they're really comfy to use after your breast surgery. Let's take a look at this one. So we just turn it on. We've got a little heat option here as well, so as long as you haven't got a lot of heat in the area already, you might want to warm that up, and you can just apply some self-massage to the area yourself, either with some circling movements, working along. You can go down and really help with drainage. If you haven't had any damage to your lymph nodes, then you can go up towards the axilla in order to help drain, which will be towards the axilla. If you've had some lymph node surgery, let's just take that drainage along to the central part of the chest, down to the abdomen, and round to the back. And this is something that you could have a go yourself. If you've got a new scar and you don't like a feeling of a kind of stretch on it, you could simply start off by holding the scar with one hand and then doing some nice sweep movements away. And don't forget, it's not just the scar that is suffering after you've had a breast surgery. All of the area around has a response to that surgery. So treat a really wide area. Definitely do some extra concentrated work on your scar, but think about all of the area that might have been impacted during your surgery. Let's have a look at this Cubble massager. So this one provides a really deep vibration. So I would say good for scars as they kind of mature a little bit more. You'll be much more aware of the vibration. That oscillation through the tissue is really helpful to help break down some of that deeper fibrosis that can form after breast surgery. And as I say, this is really soft, comfortable to use, and you can work more specifically around an area, or you can do some nice sliding, gliding movements. I think these are great little devices which are really affordable for home use massage. And with this nice soft head and the gentle vibration, it's quite hard to cause any damage to your scar. Always get some medical advice if you're concerned about your scar.